Hi, this is Sunil from Ravel Therapies, providing remedial massage.
Limassol, Cyprus.
I would share some massage therapy techniques with you that I use at my clinic in Neutral Bay. Today we're going to look at the upper trapezius and the posterior neck muscles. Very common complaints with a lot of clients getting the sort of raised shoulder issues that they have with the tight trapezius muscles, which can cause a lot of pain all the way up through the neck and into the head area. So a big a common muscle imbalance is the upper trapezius muscle, which gets very tight and short, and it tends to dominate the lower trapezius muscle. So it's a great way to start, to just strip this muscle down. You can use your knuckles, just go nice and slowly. That helps you to release it at a myofascial level. You can move around and take that all the way up to the superior attachment of the trapezius muscle. Just to accentuate that stretch, you can ask your client, Camilla, can you just tuck your chin in slightly for me, please? And relax. Is that comfortable for you?
Yes.
And you can get a nice stretch through that trapezius muscle. You can use your thumbs, going right up to the attachment, which is a broad, flat tendon. Just rolling over that attachment to release that. Some broad strokes are always nice as well. Pulling the arm down, pulling the shoulder down to get a stretch. Another big culprit is the Levator Scapulae. So the Levator Scapulae and the pec minor muscle, they work together to cause a downward rotation of the scapula. And working together, they reduce the space in the top of the glenohumeral joint. So with overhead activities, you get compression of these tendons. The supraspinatus is a classic one. So it's always, with most clients, it's really good to release that Levator scapula and that pec minor, and to look at strengthening the lower trapezius muscle. The issue with the tightness of these muscles is that they actually inhibit the upward rotators of the scapula, which also happen to be the stabilization muscles that stabilize the shoulder blade on the ribs. And when those muscles weaken, any load from carrying objects or anything like that tends to work its way all the way up into the neck, because that stability, that anchor point, is not there. So a good way to release the Levator scapula is to take the arm up, and that upward rotates the shoulder blade and puts that Levator scapula on a bit of a stretch. You can ask the client to take that slightly forward, making sure they're relaxing. And you can go right in here, pulling that scapula down and stretching that nice and gently all the way up to the transverse processes. Just be gentle, because it can be quite tender on the tips of those transverse processes. Is that okay for you, Camilla?
Yes.
It's useful to go slowly. It just helps the myofascia to release, rather than just doing the really fast strokes. The other thing you can do with the Levator scapula is to take this arm up here and do some cross fiber work. And again, this can be quite slow and gentle work. So you just use your fingers, just sink in, and use that shoulder, use that movement to roll those fibers laterally. So one of the issues with these muscles here is that they tend to go into a medial rotation, and that's their dysfunctional position. So what we're trying to do here is to roll those muscles back out laterally.